How do you know if you have Hashimoto's disease, which is an autoimmune condition that's attacking your thyroid that gives you hypothyroidism? Let me tell you about the 2 tests that you need to pull and the 1 test that the doctors are not pulling and they miss it all of the time. I'm Dr. Scott. I've been helping people for 20 years with all sorts of chronic conditions like Hashimoto's disease. Okay, so the 2 markers that you need to pull is one called a thyroid peroxidase antibody, or TPO-AB for short. And this is the one that most doctors are pulling if they're checking you for Hashimoto's disease. However, you definitely need to get the other marker that most doctors are not pulling. So the other marker that you need to pull is called an anti-thyroid globulin antibody. So you need both. The reason why you need both, because you can have a normal TPO antibody and have a positive anti-thyroid globulin antibody. But if you don't pull both, you pull just TPO, then they tell you that you don't have it when you really do have it. Well, of course, you do need to have a TSH and a T4 to be out of range, as well as the antibodies to be technically diagnosed with Hashimoto's disease. But really, when you have Hashimoto's disease, whether you have a positive TSH or T4 doesn't really matter to what we're doing, because you have an autoimmune thyroid. That's how you check for Hashimoto's disease. Now, let's say you go to your doctor and they actually check you for Hashimoto's disease. Now what? Well, now what you need to do is get to someone like me, because unfortunately your doctor, your primary care physician, your endocrinologist does not treat Hashimoto's disease. They will treat you if you have lack of thyroid hormone and prescribe Synthroid, but that Synthroid and levothyroxine does nothing about your autoimmune condition, and that's what Hashimoto's is. Well, that's what we do with people, is we help them through this process of putting your Hashimoto's into remission, because you can put it into remission. If you're struggling, you're looking for solutions, click the Linktree link in my bio and we'll be happy to reach out to you and see if we can help you.